Hi everyone, my name is Anita Wallace and I'm Chair of the Lymphedema Support Network. And I'm delighted to welcome today Dr. Catherine O'Leary, GP from Oxford, who is joining us for the fourth in our series of our expert question and answer sessions. So welcome Catherine, and thank you so much for agreeing to join us. My GP keeps getting my compression prescription wrong. Why is it so hard to get right?
So there are lots and lots of different compression garments, thousands, and each one needs to be entered into our computer system. Sometimes the codes aren't complete, and there's so many variations that a garment can have. So, you know, the size, the color, the length, the degree of compression. And unfortunately, sometimes those steps don't go, you know, quite right, and the wrong garment's prescribed. Of course, it's a big unnecessary sort of cost to the NHS when garments are prescribed that are wrong. It's a massive hassle to patients. I know, I've been in this situation herself. I have heard of some areas nationally that are organising this centrally and getting great results with getting the right garments to the right patients and saving costs. I'm just sort of hoping that maybe sort of working together with patients, we can hopefully bring about sort of more consistent positive experiences for them. Often once you've got your compression on the system, then it's just a matter of issuing a repeat, and once we've got the right one there, then that's kind of hopefully relatively straightforward. It's probably the problems start at that initial step when the prescription gets put on the system, and I don't quite know why it still seems to be a bit of a consistent problem, but I think it's a complex process with sometimes incomplete information and so many different garments on the, you know, on the prescribing.
Yes, I mean, when we say thousands, if my memory serves me correct, I was talking to one of the manufacturers, and I think he said there were over 50,000 different permutations: open toe, closed toe, you know, full length, knee length, you know, silicone grip top, different colors, different strengths. You know, it's a minefield, quite honestly. But it might be, you know, helpful for a GP if your clinic put very clear instructions on the request letter along with the telephone number of the manufacturer, so that they know who they can call if they run into problems. But yes, it is a major problem out there, and in getting it wrong, it's, you know, more cost to the NHS, which, you know, isn't helpful. But yeah, I know it's very hard. So
yeah, as I said at the conference this week, it sounds like they've done great work in Wales with this. I've heard of places in London that have managed big cost savings by kind of organising this centrally and doing the whole process without kind of GP involvement. I'm not sure if that's something that will get rolled out in other places, but it does seem to work there. But well, there, hopefully, you know, maybe we can sort of try and help bring about some improvements with this. But I know it's been a problem for a while, and maybe not an easy thing to solve, although it probably seems easy from a patient point of view. That
it's not easy, you know. I mean, LSM, we do understand that it's not straightforward. You know, there's so many different variations on the type of compression that people wear, so that's one of the issues. Somehow or others, the system needs to be simplified. Thank you.